Even if you don't have lung disease, it will be beneficial to whatever you're going to learn today. We shall go through exercises, stress test, to make sure you are fit to go through exercises. What is VO2 max, aerobic capacity, the breath of life, aging lungs, pulmonary rehabilitation. Why exercise? So if I tell you that I go to work every day, 5 Fatima, 5 floors up, I don't take the lift, I climb the stairs 5 floors up. Is that exercise? Very good, it's not. So why we exercise? To improve general fitness, improve muscular strength, very important, improve flexibility, and the bonus point, maybe trim some fat and reduce weight. And to develop good posture and image, stand up straight. How to begin? If you're age 35 and above, you should seek medical advice first. Because sometimes if we want to really push you real exercise, you have to go to a target heart rate. We will tell you what is the target heart rate. You choose your exercise, the exercise that you like. Somebody may be running on a treadmill, but you may not wish to. You may have a bicycle, walking, jogging, whatever to you. Suitable clothing, not too tight. Good footwear, invest in a good shoe, and plenty of water, especially during this dry season. All exercises are good for general fitness. The word is general fitness. Everything is good. Even if you move around, it's good. But there are certain exercises which are more in the sense of muscular strength, like rowing. Not many people do rowing here because the machine is quite expensive. In the West, they do. And of course, rowing and dancing, also a lot of flexibility. Like yesterday, we attended, trying to remember the people dancing there. Can you see how much flexibility they have? The young people can twist this way, that way, and then that is called flexibility. But don't try at our age, maybe, my age, don't even think about it. Walking is good, excellent for the elderly. Those who are not fit and those who are convalescing from any illness, walking best. For jogging, up to age 60 years old, don't go beyond. And if it is done regularly, running, even a lower age limit, 50, because you can injure your joints and it's more tough. So don't try too difficult exercises. Cycling is good, especially if you have a recumbent bicycle. And if you have back problems, a recumbent bicycle will be very, very good. And there's also less weight on the joints. So it's easy, especially patients with osteoarthritis, which is pretty common. So exercise with the bicycle. Rowing seldom now, because we have Kinta River, not enough water to row. Okay, or maybe I'm trying. No, do you know how to take your pulse first of all? Do you know how to take your pulse? If you don't, never mind, buy a pulse oximeter. Just flip the thing in, there you go. You have the pulse there, and then the oxygen saturation level. And in fact, all of you after this talk should get a pulse oximeter. I will tell you why. So what's the maximal pulse rate for your age? So you don't exercise too much. You time to about 70 to 85%. So your age, 220 minus your age, that will be the maximal. Maximal. Even when we do stress tests for patients, we never usually go to maximal because the patient may collapse. So we usually go to 80% of target heart rate, the target heart rate. And the pulse rate can be increased with exercise intensity. So if you are on a stationary bicycle, you can increase exercise intensity simply by cycling faster. Then you find that, your legs also cannot chase up with your speed. Your legs all go haywire already. Then you increase the tension of the machine. Then you find that, and if you have a pulse oximeter, that is where it becomes very useful. You can find it going up, going up, going up, going up, going up. And that is where you see the response. So the pulse oximeter, all must buy, very cheap only now. But don't buy a too cheap one, Get a respectable one. But the medical one could be quite expensive. Ours is about 600 quid. So you can buy a cheaper one. And then you must maintain the target heart rate for some time, For some time. at least 15 to 20 minutes continuously. So when you see your pulse oximeter going up, and what is your target? What is your target? What's the magic formula? 2 minus your age?
85.
Very good. Another coffee for you. Very good. Huh? Okay, so you have to maintain. And then for extra physical fitness, then you must increase it to 30, 40 minutes. So minimum 15 to 20 minutes. So this is the picture. What do you see? Maybe tell me what you see here. What do you see? What do you see in this graph? X-axis is time, y-axis is percent maximum heart rate, maximum heart rate. So you're targeting 70 to 85%. So what is important to realize is that you must have a warm-up at the beginning, flexibility, just warm up slowly, and then you must have a cool down. And as you can see in this, the pulse rate goes up, and you maintain. And what is the magic formula again? What's the magic formula? Maybe I want to serve another tea. Who is that magic formula again? Exactly. Perfect, perfect. Wow, I'm getting very happy. All the membranes. Got. Okay. And then after that, you reach target 15, 20 minutes in the beginning, then maybe 30, 40 minutes. And also how long, how often you need to do it? How often? To get fit faster, you do it more often. But in the beginning, maybe every other day, rest Saturday, Sunday. And then if you're really very good, then every day. But don't get exhausted. Always go slow. Each change is usually 2-3 months. 2-3 months. Okay, then you must have a personal exercise program. Like if you are a member of whatever club in Ipoh, they've got exercise trainer. So if you go to a program, it will be the best. So they can assess you, how fit you are, ask you some questions, and then, okay, you belong to the basic. It means you haven't been exercising, always just walking, or you are advanced, you'll be a marathon runner. He says, I don't need to teach you. He says, you know everything. All right. So very importantly, get the level of fitness that you're in and start from there. And each change from basic to intermediate to advanced is 2 to 3 months in duration. Cannot be faster than that because your body needs to adapt. So to improve fitness level and to maximize fitness level. So you need to continue. And then maybe later on, you're fed up, you will change another sport. Let's say, tennis, football, or whatever. Just to have variety, cannot be too stale. So if you have been riding a bicycle in the house, watching the television, the Chinese opera, whatever, then maybe it's time to go out to see some greenery. But be careful that you have to wear helmet and all. Because accidents have occurred because of the many potholes in Ipoh. Ipoh has everywhere also pothole. So your unfortunate bicycle falls into that. So remember, always wear helmet and maybe must be very good at balancing too. Then you perform cross-circuit exercises. Maybe your house has a treadmill, a bicycle, a rower. Then you jump from here and there. That would be right. So you get exciting. You get changes, different machines. Then you're more likely to continue because you won't be bored. And now that you are fit, fit, what else to do? Build some muscles. Looks nice. Look muscles. Look at the mirror. And also in the next one, to install some mirrors. The mirrors, I like to install mirrors. So the mirrors, so body shape, that's the next stage when you have got the general fitness. What about exercise stress test? What is it? This is the test that we do to make sure that the patients, especially for us, we are seeing people with disease, heart disease, lung disease. Obviously, they cannot be as good as you who are normal, So the very minute they exercise a little bit, you're already breathless. So very often I hear my patients say, you want me to exercise? I can't even breathe. You want me to? That's the first thing they say. I can't even breathe. You want me to exercise? How to do that? So it's very important. So how do we judge? How do we know how much a person can stand in terms of exercise. That's why we need to do a formal stress test if possible. But because it's cost a little bit of money, a lot of people don't want. They say, no, I can do, you know, usually they say they can do it at home, you know, okay, so fair enough, all right, so we just let them do, but any exercise is better than no exercise, just lying on the bed. So the treadmill or the cycle ergometer, every 3 minutes, we will increase the load. If it's a treadmill, we increase the speed and we increase the incline. Obviously, that will require more energy, right? So it's how we stress. Then we look at the heart, whether it's doing well, not well, any arrhythmias, whatnot, and the blood pressure, etc. And we are always looking for, when we do the stress test, how breathless the patient is. We have to ask them in a scale, their subjective feeling, how they feel, you know. Like in Chinese, what chin hey, you know what I mean? What chin hey, you know, the way this is going to, the respiratory system is going to collapse. That means no more breath, whatever. Chin hey. So it will tell you, you know, that will be stage in the box scale 10, severe. So this is one a simple scale that will show the patients. If the person comes, you know, okay, now you start the exercise, then we see. Sometimes we just ask him in the scale of 10, 0, nothing, the rest, 10, very severe, like chin hey, and in between 5, 4 will be between, I say, I can still do it, but I'm a little bit breathless. Now, the other thing, of course, is to talk to them, like I'm talking to you. I can still, you know, I'm still talking to you, you know, and you know, how are you? Yeah, doing well. Then as I exercise more, I become more breathless. Yes. But how are you? You are better, you look well. And then if I go higher, right, how you, it's very severe breathlessness. Very severe. This is how we sense out how severe the breathlessness is by talking to the patient. Then we can grade them. So we know roughly when to stop. So when we come out of the stress testing, we will tell them, okay, you can only exercise up to this level and not more. This level and not more. So this is what the exercise is. So we're looking at the effort tolerance of the person as he is, whether he is adjusted or trained to exercise or not. So that's very important. So what is VO2 max? VO2 max is actually used mainly for athletics to gauge aerobic fitness. We won't go very much into it. So you need to measure the carbon dioxide, oxygen level, it's cardiopulmonary function test. And what is important to know is that it declines with age. Even if you are well right now, very athletic, it will decline with age. No doubt about it. Men's VO2 max is greater than a woman's. And if you exercise, the VO2 max will improve. And of course, it decreases with altitude because of lower oxygen concentration. And this is a very interesting graph. Look, you have here highly fit people, the green line, average fitness, and the red line, low fitness. So I do not know which one you belong to. Maybe you can identify whether you are green or black or red. But having said that, at whatever level you are in, it is going to drop. It is going to drop. So this age progresses, it is going to drop, no matter at what level you start at. Now, looking at this VO2 max, it's a max drop. Okay, now this is the scale is at 10 mils per kilogram per minute. The evaluation is mils per kilogram per minute. Oxygen consumption, maximum oxygen consumption per kilogram per minute. 10, 20, 30, 40, 50. Now, question to you, another extra bonus, 2 cups of coffee for you today. What level of VO2 max is required to climb the stairs? That is the super duper question. What level of VO2 max is needed to climb a flight of steps? It's very important. Then you can gauge whether you are able to do that at different levels of fitness. How much? Guess. Come on.
35.
35. Yeah. Yeah. Yeah, looks like I'm going to have served a lot of coffee today. Yeah. 35 to 45 for men, 30 to 40 for women. So where is it? 35 to 45. It's at this level. Look at that. So if you have not been exercised at a low fitness level, or maybe even average fitness level, at cutoff point, at age 55, you are having problems already. Only left with the fit people, that able to climb the stairs. You will have difficulty if you belong to these two as you grow older. So when you reach 75, you have to stay downstairs already. That's what we advise for Asians. Usually we advise them to stay downstairs, 75, because we know they are not exercise fit. See, you see? 35 to 40, let's say this year. So you are actually here. So, but the person who is very fit can do that, no problem. But if you're lower, that's it. Too bad, cannot climb the stairs. So you have to stay downstairs. So the next question is, what is the VO2 max for daily activities of living? For daily activities of living, that means brushing teeth, going to the toilet, on flat ground, and tidying up, dressing, So what is the level? VO2 max. What is the level for doing basic activities of daily living? What is it? How much? Guess, come on. Another coffee. I will be short of coffee soon already. Yeah. 20, yeah. Slightly below. 15 to 20. So 15 to 20 is, wow, lucky, So most of the people can do activities of daily living. So no problem. So I see people smiling already. Can do good. So another one, very quickly then, a woman and a man, let's say you belong to the elite group, very, very fit. So as you can see, the VO2 max decreases with time at whatever level you start with for men and women. But the point to make is actually this. At age 75, 80, you actually belong to the worst of the teenager. Your strength is the last quartile. So if you have a teenager running all over the place, when you are 70 years old, you're only the 1/4 of what could have been doing when you were young. That's it. 1/4 only. So that's the picture it is. So what? Though there's still hope. So you must listen through. Still hope. So how to improve the VO2 max? Endurance training. All right. Go cycling, swimming, running, whatever. And of course, if you really don't have time, like us, we do high intensity interval training. So what I do, so it's actually high intensity interval. That means you go to your bicycle, so and then hop to another thing, or maybe a treadmill, rest, maybe, and within half an hour or 20 minutes, you get very good exercise benefit from the things that you are doing. This is an example of a 10 minute only, HIIT walking. This for the convalescent people, elderly, not fit people. So warm up, cool down. So the interval is at 1-2 minutes, increase by brisk walk. 3-4 minutes, power walk. 5 to 6 minutes, brisk walk. So you can do that. Polo ground, you can do that. And polo ground also good because there's a hill there, there's an incline there, which is very good. 20 minutes, HIIT cycle. So another example. So it's an example. So it's important to monitor. So when you're doing the HIIT exercises, it's important. So you go up to your intensity. During the intensity, 80 to 90%, push it up. So with me, I got a bicycle there, so I put it there, pulse oximeter, and I see coming up, going up, and then I maintain. Then of course, there's a TV there, there's a clock there. Maintain, and then drop. So as you are beginning to become fit, the drop back to 50% of your target heart rate will be pretty fast, and you can gauge whether you're doing well or not, because if you get shorter and shorter, you go back to normal quite fast. So initially, you maybe take maybe 1-2 minutes for the heart rate to drop back to 50%. The next time you do after 1 month, it will be 1 minute. That means you're recovering very fast. That's a good thing. So what is the breath of life? This is important, especially people with lung disease. Now, do you realize you're breathing? Usually it's involuntary. Involuntary, it is usually, you don't realize actually. You don't realize, because the control center, with all these sensors, you got receptors of your blood in the blood vessels, and also in the midbrain and the pons there, regulatory centers. So it will adjust the pH, acidity, carbon dioxide, oxygen level, all this in short. And then it will vary the rate accordingly, fast, slow, etc. And then there's also the voluntary part that you can control. Okay, speed up my respiration. You try and see. You can do that. So just basic concept. Usually involuntary, you don't even realize your heart is pumping, right? Similarly, you don't realize you're breathing. And simply breathing is to bring air into the lungs, into the alveoli, where there's exchange of gas. So this is where the gas exchange occurs. Breathing, involuntary as it is, requires effort by the muscles. Usually it's the intercostal muscles, the external intercostal muscles, and also the diaphragm. Intercostal muscles, 25% of the value of the lung you breathe in, 75% comes from the diaphragm. So the diaphragm has to be strong. There are also accessory muscles of respiration. That means if I were to ask you to breathe fast, like during exercise, you will require your accessory muscles of respiration because you're having a demand for it. When the diaphragm contracts, because this one is a closed unit, the thoracic cavity is a closed unit, there's negative pressure. Therefore, when the diaphragm comes down, air is sucked in because of the negative pressure. Expiration usually is involuntary and usually does not require effort because it depends on elastic recoil. That means you expand the lung is so spongy and so elastic, but its own force will collapse it. So breathing in, effort required. Breathing out does not require effort. So it is passive. So the inspiratory muscles you use are the intercostals, as we mentioned, the muscles here. For respiration, for breathing, you must move the ribs in the rib cage and also the diaphragm. These are the two things that you must move. The ribs, the diaphragm. Now, there are muscles attached to it. And this is the diaphragm. There are also accessory muscles. Accessory muscle of breathing, meaning to say, when you breathe harder, there will be muscles in the neck that is being used. Muscles like in your breast muscles also being used because they are attached to the ribs and also something known as your shoulder girdle. So that's why, after when we explain the physiology of it, you will know why you do that. So there are also muscles, the serratus, and then the scalenes. Get a few names, we don't go to too much details. And then the sternocleidomastoid. All right, these are the accessory muscles of inspiration for breathing in. So they will be activated when you are exercising very heavily or when the person is having disease of the lungs, then they have to use extra effort to breathe. So people with lung disease needs extra effort to breathe. And those are the people who are conscious of their breathing, because we find that they're short of breath and they're breathing faster. They will be aware of the breathing. For you and I, normal, we are not aware. Okay, so these are the muscles. Now, why is it important? If it is just the respiratory muscles, which is involuntary, just breathe, huh? But there are the extra muscles like the chest muscles, the neck muscles, also engage for people with lung diseases. That's why for people with lung diseases, if you ask them to brush their teeth, comb their hair, shower, they're very breathless. They go to the bathroom very breathless. Why? Why? Why doing upper limb movements like combing the hair, making nice, taking things on the shelf, they are very breathless. Why? Because they're using the same accessory muscles of breathing. The same muscles used to breathe on demand, extra demand, is being used for this activity. That means you are tiring these muscles out. So when you tire these muscles out, then of course the person who is requiring these muscles will breathe more difficult. How to improve these inspiratory muscles? Now we should do some exercise. Diaphragmatic breathing. What's diaphragmatic breathing? So diaphragmatic breathing is to train your diaphragm to breathe. All right. So okay, let's put a hand here. Now, if you breathe in, normally, this one will move 25%, bringing the air in. This one will move to bringing 75% of the air in. So, but because you're gently moving, so it's gentle. So now you want a big excursion of your diaphragm. You really want to work the diaphragm. You take a deep breath. See that? See the side. Breathe in. Do that. That is training your diaphragm. You breathe in, the thing comes out. The tummy must come out. You do that? You're doing that right. So that is diaphragmatic breathing. So exercise. And it will be very good for deep breathing. Why? Because you're expanding the lower part of your lungs. You see the lungs, diaphragms at the bottom there, right? If you contract the diaphragm, the lower parts of the lungs get ventilated, stretched out. More air goes to the bottom. That's why for us medical doctors, it will be lesser atelectasis, lesser collapse of the lower zones. And elderly, you find that a lot of the lung at the bottom are collapsed because they don't breathe deep enough, so they get stuck. Atelectasis, mild collapse. Okay, chest expansion. There's people like that. Do. Try do. Chest expansion, don't knock the person outside. Breathe in. Yeah. That is you exercising your sternocleidomastoid because it's attached to your clavicle and also the sternum. As you do this, so you're exercising this. So those are the muscles involved. Shoulder shrugs. Yeah. So you're lifting this part of the ribs up. Shoulder shrugs. Scalene stretch. Stretch. The scalenes. Yeah. Elbow circles. So those are the muscles that you see. Serratus anterior and the pectoralis major. So this is good. All these exercises will be good for people, especially with lung diseases. Pectoral stretch against the wall, the push, so the pectoralis major. And then there are also devices for you to breathe in under resistance. So they are known as infiltrate muscle trainers. Won't go into that. That is an equipment. We're going to the aging lungs now. all of us age, right? So going back. So many areas involved. Immunology, air transfer, air sacs, airway, epithelium, everything is involved. In general, what happens? Weaker respiratory muscles, reduced cough reflex, change in the rib cage. All right, some people develop kyphosis, the Dowager's hunch, because of the osteoporosis. Loss of elasticity. You know, the lung supposed to come back to its usual shape after inspiring, right? Because of elastic recoil. Decrease in air exchange area and increase infection. A lot of the elderly passed off because of pneumonia. Usually our capacity, lung function in terms of FEV1, 100%, 50%, in terms of lung function in terms of FEV1, usually maximizes at about 20, 25 years old. And after that, no matter how it is, how you blow, how fit you are, it will decline. It will decline with age. And there are also people who are born where they don't reach full capacity. Somehow or other, the lungs are not of the usual capacity compared to other normal people. And if one smokes, then the deterioration of lung function is even faster. You see this line? It drops very fast. So never smoke. It's the first thing. And just keep your lung healthy. But no matter how it is, it's going to decline. But it won't decline until you're breathless. If you start with this normal level, at this level, you're still okay. You know, because 100% at these levels at 75 age is still about 75%, still within normal range. You won't be breathless. But if one smokes, then really down. Of course, the good news is that now we know, and they are in China, they are already doing some experiments with autologous cell transplantation for COPD, where they harvest the P63 cells, grow them a lot, put them back in. And apparently it helps with the lung function. So they're still undergoing trials now. If it works, it would be fantastic. And of course, there are cells in our body innate to us, basal cells, Clara cells, bronchoalveolar stem cells, alveolar type 2 cells, we continually replenish cells that have died or become senile. That is the good news. God has made it so that we are able to have these cells that still can make some of the cells for us to continue living a healthy life. Pulmonary rehabilitation now. Time for some exercises for you. If you breathe shallowly, and it has to be fast to get the oxygen in, right? So there gets tachypnea. So this is chest or thoracic building. So shallow breathing. Those people who are anxious, they breathe faster. Short, so it's not very good. So the lungs don't expand properly because short, it will come out. The air goes in, come out too fast. Don't go deep in. Pulmonary rehabilitation requires breathing retraining. Retraining, the word is retraining. Then you have to become aware of the over breathing. Normal breathing, we are not aware. But people who have lung diseases, when they are over breathing, they will know. You got this sensation of not enough air. So they breathe faster. They are aware of it. And so what is important is to learn to breathe through the nose and the diaphragm. The nose and the diaphragm to reduce the breathing rate. Once you reduce the breathing rate, then you're not so aware. That would be the good thing. Because if you breathe fast, there are these stretch receptors that they can sense it. There are muscles, the stretch, there are receptors that know that you are breathing fast and sense messages to your brain telling you that something's wrong. You have to slow down. So what is your normal breathing rate? You know your pulse rate, isn't it? Everybody is. So I say the heart is more important than the lungs. Everybody says heart, pulse rate, I know. Lung rate, heart, breathing rate, don't know. How much? Anybody knows? 12 to 20. Usually 12 to 15, normally you and I, but the limit is 20. Inspiration, expiration, usually 1-2 seconds only, So you breathe right now, you want to be aware of your breathing. See? Seconds only. 1 to 2 seconds in, 2 to 3 seconds out. And it varies with age. When you're younger, faster breathing. That's why I see the child breathe faster. So just remember these numbers. Just remember if you wish to count them. So most of us want ourselves to breathe through the nose. We are a nose breather. We don't want to be a mouth breather. See, I don't see people breathing through the mouth. How do you? It's so awful, isn't it? So some people are, how, yeah, but then anyway, but why the nose? Why is the nose so important? The nose is very important because it got hair, got the mucosa, inside there got 3 folds, turbinates, capture dirt. That's why the big dirt, capture dirt and take it out. And then also warm the air. So beautiful. And also catch bacteria and particles. And of course, when you breathe through the nose, it will make you breathe slower. There's some resistance bring to the nose, but normally it's sufficiently large enough. But people who have nose problems like allergy, one side nose block, then you can see that they have difficulty breathing because then it's narrow sufficiently, the resistance will be high. But normally we don't because our nose passage is quite big. Pursed lip breathing, what is it? Now, okay, practice, come. Now, pursed lip breathing is very important for people with COPD and emphysema. Not so for the interstitial lung disease, not so much, but for COPD and emphysema because their elastic recoil is not normal because their elastic fibers are affected and are damaged, and therefore they are not so springy anymore. They're also like that, they're not springy, So when they have difficulty breathing, naturally they will try to breathe out the air. That's when the airway, because of the lack of elastic fibers holding the airways, they collapse. So for people with COPD, especially moderate to severe, or those people who are wheezing with asthma, they must use pursed lip breathing. You can teach your whoever has asthma or whatever, you can do this. Okay, try. Breathe slowly in through your nose. Make a little snout. Slowly breathe out. What essentially one is doing is that you're putting pressure into the airway system so that they don't collapse so easily. So that is the idea of pursed lip breathing. Especially so for people who are having severe asthma, COPD, and emphysema, where there's airway obstruction. So what is this active cycle of breathing? Now, the people who are in hospital, we usually ask them to do this active cycle of breathing. Control breathing. What is control breathing? That is when your pulse oximeter comes in very suitable. Now, if you have anxiety or panic easily, or one has lung disease and breathe very fast, put the pulse oximeter on, tell your mind, sense your fast breathing in your mind, and tell your mind to breathe slower. The pulse rate can actually drop, oxygen improve. So this is a positive feedback. So the pulse oximeter also can be used for feedback, so that you know what to do. So control breathing is very slow breaths. Now you want to be conscious. You think about your breath. You want to be conscious about your breath. You breathe slowly. Then the pulse, if you can have the pulse oximeter, you can see it dropping. The pulse rate drops. Slowly drops. The oxygen improves. Then you get this positive feedback. Then you're going to do it more often. You feel great. You feel nice. That is controlled breathing. Deep breathing is diaphragmatic breathing that we have taught. So inspire, expire. All right, deep breathing. expand the lungs, and also to move secretions. And this is very important. Now, this is useful for all of us. If we are having a bronchitis, flu, you got a lot of secretions coming from the airways. You want to do this to bring up the phlegm. The huffing is actually to bring the phlegm from deeper airways, deeper airways. How deep? How far? Will be like, because the phlegm is so tiny, right? Normally, we have this cilia moving in our lungs. We have this little bit of phlegm that we strip in and then we swallow, all right? So for the phlegm at the very deep part of the airway to move up to your throat to be swallowed, it's like traveling from Ipoh to Singapore. It takes so long for it to travel. So when you do the huffing, because you've got so much phlegm, you want to bring it out. You only want to cough it out when they are up here. The phlegm is up here. So you do the huffing. So how you do the huffing? Okay, do the huffing. Come. You dip slowly, breathing. You don't dip deep and fast, because you got phlegm, dip. All the phlegm is sucked back inside. Useless. So you must slowly breathe. Open the airway. This is very good for you if one has bronchitis, a lot of phlegm. Long, a bit forceful, open glottis, not a cough. Not a cough, it's a huff. It's like now if you got a mirror, you want to miss the mirror. Or if you got a piece of paper, you want to move this. Maintain this, not so stiff, a thin piece of paper, then you find it like that. Long enough. So then you move, the air, the secretion will move from the lower airways until you feel this thing in the upper airways, then you cough it out. Cough it out. Because otherwise you start coughing when it's down there, you cough until you pengsan. All right, because very tired. And here sore throat. Tomorrow can see doctor because I have a sore throat. Cough until sore throat. Cough pain, there pain, So that's the reason why. Okay, now the control cough are very important also. You can do the control cough. Now, control cough very important. For people with a lot of phlegm, how do you do control cough? Is sit down with one hand here. Now, the general cough, you have to increase the pressure. All right, I'll show you why the cough faces has, right? Not so much here. You feel the strain is not in the throat. It is here. The real cough, you get this soreness, you cough very badly, soreness, because that place has to adjust and then open up again. It's where the damage is. So it gets sore throat after bad coughing. So here, when you're ready, keep breathing. Like that. All right? Push. All right? That's how you do. Control cough is the word. Now, okay, let's tell you what happens in a cough. Now, 3 phases to a cough. You have to take a deep, because something irritates you, you have to take a deep breath and try to expel whatever has gone in. Maybe it's you choke a food or a phlegm or whatever. So you have to take in a deep breath. So this will open, to allow the air go in. Then it will close. After it has closed, your accessory muscles of expiration now comes into play. Because earlier we talked about passive movement of expiration. Breathing out is passive, right? Now you want to generate a real cough out. You must use your accessory muscles of expiration to really have a dramatic hum. And that speed is how many miles per hour? The cough. That's why I can cough here and then you have the spit in your spectacles. How many miles per hour? How many miles per hour? I'll give Yeah, how many miles per hour? You travel 110, isn't it, kilometers per hour, right? After that, 120, you can just catch you. Now you will cost how much? At least half the speed you're traveling to KL, 110, about 60, 70 the kind of kilometers per hour. So how does it generate that kind of speed and force? It's because you have to develop the pressure against a closed glottis. It has to close to generate the pressure, and you suddenly open, then the thing boom come out like a cannon. You know what I mean? Yeah, the boom can go there. I think behind. So look, you can get it behind. All right. So what happens then? So you take a deep breath. The body automatically closes. The muscles, accessory muscles of expiration contracts, pressure, and then suddenly involuntary will open. Boom, all the thing goes up. And that's why, because it's so powerful, at 80 kilometers per hour, like hurricane, trees get uprooted. So your cells in your airways also get damaged. That's why some people talk about blood damage, sore throat. That's why those powers of air is so fast, like a hurricane. Like now California is racing for hurricane, whatever, what's the name? Very fierce coming. So they have to be very careful. They're chopping down trees. So that's all the expiratory muscles. To bring out the phlegm, you have to train them. Especially people who have lung diseases who are very weak, and they cannot create that cough to bring out the phlegm. Then they are in trouble already. That's why all of us must develop this good respiratory breathing muscle, so that when should we ever get ill, then we still have these muscles to cough out our phlegm. Because I mentioned pneumonia is one of the major cause of mortality in elderly. Pneumonia, and then pneumonia, you have a lot of phlegm. So you must bring out the phlegm. If not, it's all stuck inside there. So the best, so you got the muscles, the good muscles will be one big one would be your six packs. You must develop your six packs. Yes. That is a major muscle. Your six packs. So abdominal crunches, very good. The others, of course, you can train with other muscles. Your obliques, certain external obliques, exercises, abdominal crunch, blowing balloons, sleep breathing, extreme muscle training devices. These are some of the things that you want to do. Okay, so you see this picture. Tell me, how many of you do jogging, running, go jogging, go very fast, and then when you have almost finished the marathon, you come, or they go that. Why? Why this position? Why these positions? Why these positions? That's why you notice people who are having lung diseases, we will tell them when they are breathless, they go to these positions to get comfort. Why do you think they need this? Why? See that? Look where their hands are. Against the chair, against the knee, over the backrest of the chair, against the wall, on pillow, resting their head. And of course, this is high side up. Comfort, yes, of course, they must do this because of comfort. It cannot be not comfort, isn't it? But why? How does it relieve the breathlessness when the person cannot breathe? This is a natural thing. A person who is jogging, you say, or the patient's support, go on to the friend and hang on to the friend to breathe like that, isn't it? Why? Why does he do that? Obviously no dizziness, just short of breath. Just short of breath. A normal athlete also will do this. Why? Slow down the heart rate, okay. If you rest long enough, you slow down the heart rate. Okay, I'll show you this picture. Give me an answer. I show you this picture. It's related to what I said just now. Give me an answer. Why the position? Why? Because you're not pressing on the lung. Not pressing on the lung well. Well, yeah, possibly also, yeah, because you don't want to crouch like that, surely become more breathless, right? Crouch up. So, but they are sitting like that. Okay, why? There's another reason for that. Yeah. Why?
Relaxes the rib cage.
Relaxes the rib cage. Okay. How does it relax the rib cage? Yeah. Opens it up. Okay. Opens it up. Okay. Yeah, yeah, in a way, true. In a way, true. We want to open it up. But what is it that you do to open it up? What is that you do?
Support yourself to give the muscles for respiration.
Very good. 4 cups of coffee for you. Can take it on. So what happens? I told you already. Breathing requires the ribs movement. Diaphragm. These are the 2 main things that you need to know. Because you want to increase the pressure inside so that the egg sucks in. You either open up. Now, question to you now. Where are the accessory muscles of inspiration attached? The special muscles for breathing in, where are they attached?
The chest.
Yeah, accessory muscles are the special muscles, you know, the sternocleidomastoid, the scalenes, the serratus, the pec major, they are all attached to the shoulder girdle. The shoulder girdle. All right. You do this is to fix your shoulder girdle, fix your head, so that when they contract, they open up the upper part of your chest. You know what I mean? Because when the muscle contracts, it pulls, right? So when these muscles are attached here to the rib cage, to the sternum, to the ribs and all, together with the bones, the humerus, the scapula, the clavicles, the mastoid and whatnot, when you fix this position, then you can make advantage of your accessory muscles of respiration. You can take the strength of the contraction to even make your rib cage bigger so that you can draw in more air until you're settled. That is why. Understand, huh? Cannot. Because these muscles are attached to the rib cage. So when they contract against a fixed shoulder girdle and they pull the thoracic cage open. Okay, that's the reason. Okay, so that's why they go into this position. It's to fix the shoulder girdle and to fix the head. So activities for daily living. Okay, very quickly, we just go through dating, toileting, we mentioned already. Instrumental extra work. Okay, now, I think most of you are healthy. I think all of you are healthy, right? You're able to come here, right? Yeah, I don't see anybody being fast. Okay, okay, but anyway, if one has problem, you know, with the lungs and whatnot, is to do energy management. 6 principles of energy management. First of all, is to prioritize what is required, do. What is not required, let somebody else do. To stop. Plan it. If you want to go to the bank, RHB bank, a lot of money, public bank, Standard Chartered Bank, schedule it. Don't go. Public bank, Standard Chartered Bank, OCBC bank, one go. This Monday, that Saturday, whatever, plan it. Pace yourself. If you're difficult in breathing, you want to vacuum this floor, morning is fine. Afternoon is fine. Space it out. So this is the concept. Body positioning, very important. You place your things. That's why you say you use your upper limb movement, you will get breathless because you're using your accessory muscle. So to put things at the lower level. 2, push if you need be. So practice pursed-lip breathing and also mental attitude. Things are going to be all right. But remember to pray. Okay? And then nutrition. Make sure you have proper nutrition. Make sure. Proper nutrition. And what do you see now? two graphs, male, female. Let's take the upper two graphs first. Fat-free mass. What do you see? Yeah. No matter how well you eat, how much you spend on your food, if you're taking the right food, right diet, your fat-free mass is about 20s, 25. Similarly for the lung, the max will be here, and it will start to deteriorate. And at age 75, there is a sudden drop, more accentuated decline, no matter what you do. That is aging. All right. For men, definitely higher mass than women. Same thing. 20, 25 max decline. Also a very sharp decline. Age 75. Age 75. Physical activity. For all people who want to be healthy, they do whatever. So they did the study. Still the same for men and women. They usually 20s up to 75. They are able to maintain some activity. But somehow or other, either because of too much thinking, too much inactivity, loss of muscle mass, activity also declines after 75. For those who are 70 and beyond today, come here, bonus. You're able to walk here, enjoy, and go life, take a coffee. Very important. Keep healthy by doing all these kind of things. Be engaged. Be engaged mentally and physically, then you'll be well. Natural decline, no matter what we do. But okay, now, so the other thing what's very important is to reduce stress and anxiety. You can relax by music, warm up, self-hypnosis. I've got no time to go through with you, self-hypnosis. What I want to do tonight is practice mindfulness. Mindfulness now is the in thing. If you go to a psychology course, they must teach you mindfulness. What is mindfulness? Now, if you're having anxiety, is to pay attention. Now, just do it. Pay attention to your breathing. Concentrate on your breathing now. Concentrate on your breathing. Know that you are breathing in. Know that you're breathing out. And hear what is happening outside. Raining heavily. So you cannot go back. So raining heavily. So the attention in mindfulness is the current sensation. Feel it, sense it. Next is the attitude. Attitude. So if one is having difficulty in breathing or whatever, is to say, okay, I'm having asthma, I'm breathing faster a bit. It is not very important. And just having, as I get better, it will become less. Kind attention to whatever you are feeling. Or if it's a panic attack, anxiety, also same thing. Non-judgmental to whatever you are feeling. And finally, intention. By knowing that attention, now will be to know what to do next. It will be to know that there is something I can go forward for, in the sense that I can do breathing retaining. That's how you do. So this is mindfulness, and it's supposed to bring down your one's anxiety level. So leisure, if you not go through, you can do gardening, pet keeping, keep engaged. Oxygen supplement. None of you have lung disease, require oxygen. But for those people who have oxygen desaturation at rest, so when they exercise, it's going to be worse. So we will advise them to buy oxygen concentrator to give them more oxygen to do the exercise. Otherwise, they will be more inactive because the exercise they cannot breathe. The exercise cannot breathe. So negative feedback. So they don't want to do. So you give the oxygen early, buy the concentrator earlier, experience the exercises, and you definitely improve physically. So that's all. Thank you.